So today we're going to look at central nervous system infections. So there are different type of CNS or central nervous system infections. This is listed here. You have meningitis, encephalitis, myelitis, and abscess. So these classification or grouping are basically based on the location of the CNS infected. So, for example, meningitis refer to infection of the meninges. Meninges is the membrane that cover the brain or the central nervous system. Encephalitis, infection of the brain parenchyma itself, and then myelitis refer to infection of the spinal cord. So you may not familiar with myelitis, but you probably heard about the term polio. Polio actually is the short for poliomyelitis. So that is an infection of the spinal cord. Then abscess, just like abscess that you find in the orofacial area or other part of the body. This is basically localized inflammation, usually containing pus. So that can also happen in the brain. For example, in fact, quite a few of these brain abscesses are caused by bacteria found from the oral cavity. We'll talk more about that later in the lecture. So there are four types of infection: meningitis, encephalitis, myelitis, and abscess. So the type of organism that causing these types of infections are listed in this table. You don't be scared by the table. You don't need to memorize them all. The one that I highlighted in red is the one that we're going to talk more about, so you should be able to recognize those names. So the rest of them, you don't have to worry about them. So the one in red, by the minimum, you should be able to recognize the name, but not sort of remember the details about the name and so on. So this table you can see sort of group that into acute meningitis, chronic meningitis, then acute encephalitis, abscess, and then and chronic abscess. So you can see the bacteria are common cause of meningitis. So the one that we're going to talk about are the most common one. That is Neisseria meningitis, Haemophilus influenza type B, Streptococcus pneumoniae, Streptococcus agalactiae, which is also commonly called Group B strep. And then Listeria. So those are the five most common bacteria that cause meningitis. Then, of course, viruses, you have mumps virus and enteroviruses. So chronic, you can have Mycobacterium tuberculosis. This is last lecture we talked about TB. This is referred to the Mycobacterium tuberculosis have come out from the lung or from the tubercle and then migrate to the central nervous system and causing this chronic meningitis. So the fungi, you have Cryptococcus neoformans. We'll talk a bit about that. This fungi, and then encephalitis. They're always caused by virus. There's no bacteria can cause encephalitis. So you have arbovirus, which is it stands for arthropod-borne. That means an insect like mosquito, particularly, carry this virus and infect human. Then you have herpes viruses. These are the herpes simplex 1 mostly, can be herpes simplex 2, So herpes simplex are mostly found in the oral cavity, where it causes what we call herpes. So a little lesion on the lip or in the oral cavity, buccal mucosal, and the virus herpes simplex ones live up in the ganglia of the trigeminal nerve. They stay there at dormant when they travel down the nerve ending to the oral cavity, then it causes herpes lesion. If they travel up the central nervous system and then enter the CNS, that's where they can cause encephalitis. Then you have abscesses. The important one here are the mixed anaerobe and aerobe of oral origin. These are a group of streptococcus that are part of the tender part of the organism colonizing the buccal mucosa in some cases, or in the gum line. They can cause acute abscess in the brain. Then you obviously have other that listed on the right column. So those are the overview of the agent that can cause CNS infections. So we're going to go into meningitis first and discuss some of the features and organism in that in that disease. So bacterial meningitis, there are two important symptoms that you should know, that because these are a hallmark of the bacterial meningitis. That is a sudden onset of high fever, and then a neck stiffness. So sudden onset of high fever means that in 1 minute the child will maybe have a normal body temperature, and next minute the temperature shoot up to 40, 41, 42 high fever. So it suddenly just come about for that fever. Then neck stiffness is another hallmark that is referred to when you turn your head left to right or up and down, that you feel stiff and hurt, and that's another sort of clinical symptom that is always associated with meningitis. And in fact, that's what they use to differentiate this CNS. The first initial diagnosis is based on those two symptoms. Then obviously, to confirm that, you need to sort of do more work, that is getting the CSF, which is the cerebral spinal fluid. So the physician will tap into your spinal cord at the back and then withdraw a little bit of that fluid, or cerebral spinal fluid. That fluid will be sent to the lab in the hospital. They do the cell count, white blood cell count. There will be an always increase in the white blood cell. That makes sense because that indicates there's infection. Your body recruit in the white blood cell, trying to fight it off. And then also do other chemistry on the CSF, like the protein level, glucose level, that sort of thing. At the same time, they'll take some of that CSF and take it to the microbiology lab and do cultivation culture and see whether what they can grow from that sample, because that will help further confirmation whether it's bacteria or fungi or virus. If a bacteria, what sort of bacteria that is, do confirmation, identification kind of thing, and will test for antibiotic resistance, because then if the initial treatment with certain antibiotic is not responding, then they have a way to test, see what other antibiotic these bacteria are recover from the CSF are sensitive to. So there's all kinds of work to be done on that CSF. Then there are other symptoms associated with that meningitis that you can see that listed there. There are 5 bacterial species account for almost 90% of the cases bacterial meningitis. This is what we already just listed in the table. So the organisms look something like that, so they get some idea of what we're talking about here. Streptococcus pneumoniae, obviously Streptococcus, we came about that last 2 lectures. This gram-positive cocci in chains. So Streptococcus pneumoniae will have that appearance as well. You do gram stain. Neisseria meningitis have a very interesting, unique shape and appearance. So it's called gram-negative diprococci. Diprococci means 2 cells. You can see the 2 cells stuck together. And not only that, you can probably see it's sort of like kidney bean shape, right? So like you have kidney bean looking. So 2 kidney bean cells stuck together and a gram-negative. So very easy to pick it out when doing a gram stain. And then Haemophilus influenza is a gram-negative rod, so very short rod. And then Listeria monocytogenes, obviously gram-positive rod. And you can see actually in the Listeria micrograph there are hair-like structure coming out from the 2 ends of the cell. Those hair-like structure, they are flagella. So this actually you can see the flagella quite clearly. So this is a motor organism that can use this flagella to swim about. So Streptococcus pneumoniae, sometimes we also call pneumococcus. Remember, this is the one causing pneumonia, pneumococcal pneumonia. We came across that lecture before. Then Neisseria meningitis, sometimes we also call meningococcus, are probably the most prevalent cause of bacterial meningitis overall. Those 2 organisms are probably the most important among the 5 that we just listed in last slide. Then Streptococcus agalactiae, also called group B strep, is the leading cause of bacterial meningitis in newborns. Why? Because Streptococcus agalactiae is found in the female vagina. So if the mother carry this organism and then during birth the newborn will come in contact with it, and therefore can potentially lead to infection of the central nervous system. So it's estimated to 70% of the cases in newborns are caused by this Streptococcus agalactiae. The Listeria monocytogenes is only 10% of the cases, so it's much less common. Listeria is mostly came from we come in contact with it, consuming contaminated food, milk included. We'll talk more about that in a second. And then the last organism, Haemophilus influenza type B, is the leading cause of bacterial meningitis before 1990s, and then since after 1990 to now, Haemophilus influenza type B, which is no longer causing any cases of meningitis. The reason for that is that the implementation of childhood vaccine called HIP stands for Haemophilus influenza type B, and this vaccine is given to young children together with the DTaP vaccine, the diphtheria, tetanus, and pertussis vaccine. So in that one needle, you also contain a Haemophilus type B, and many times also contain the vaccine for polio. So they're actually fighting in in the needles in a lot of cases. So the implementation of this vaccination actually is a success story. It has controlled infection by Haemophilus influenzae. Obviously, Haemophilus is it, it started with infection of the lung, and then it moved on to the central nervous system in cases before the vaccination. There are quite a large proportion of the cases that lead to central nervous system infection. If the person recover from that, they will also suffer from permanent neurological damage. So I think that was the reason why in 1991 the American Association of Pediatrics have recommended this universal vaccination against Haemophilus. So transmission, this is talking about how we come in contact. Neisseria, Haemophilus, Streptococcus pneumoniae is through inhalation of respiratory droplet, because these organisms are typically found in the throat area. If they colonize a person, they will be found in the throat area. So some person cough will expel it as in the respiratory droplet. If another person nearby, you will inhale it. That's how you come in contact with it. Then Streptococcus agalactiae, I already mentioned, this mother will carry it to birth from come in contact by the newborns. Then Listeria from contaminated food, particularly under pasteurized milk, cheese, and meat like the processed meat like ham, the ham that you use for making sandwich, the packaged ham and smoked turkey and that sort of lunch meat. So those are the kind of things that might potentially carry Listeria. You might remember or heard of now and then there's this recall of contaminated milk or lunch meat or cheese. Not that's common, but so now that's because the Food Inspection Agency they test this sort of product regularly, and they found that they are present in the Listeria in the sample, then they issue the recall. Spread, this is talking about spread. When a person come in contact with it, they obviously central nervous system is supposed to be a sterile environment. It's well isolated. Outside bacteria or even conventional bacteria, they cannot get in. So they had bacteria had to find a way to enter the central nervous system. So they first come to the body or they reside on the body mucous surface. They have to find a way to get into the central nervous system. So bacteria usually spread to the managers from infection of the lung. So like person have pneumonia or from infection of the nose sinuses or inner ear where you have otitis media, ear infection. So from all those different locations, different infection at different location, they still stay out of the central nervous system, so they need to get in the central nervous system. This is to blood. So they sort of enter the bloodstream, so creating what we call bacteremia. Remember the term bacteremia refer to bacteria present in the blood temporarily. So they get into the blood, and then obviously the circulation of the blood will carry them to all parts of the body, including structure that found on the central nervous system that called choroid plexus, where that is where the the bacteria can spill over to the other side of the membrane of that choroid plexus and get entry into the central nervous system. So they get through the blood circulation, get into the blood, through circulation of blood, they get to the central nervous system. So bacteria you see enter the CNS through this route. And then you have head and neck surgery that can also another way for them to get in. Viruses are mostly not listed here. Viruses usually gain entry to central nervous system to the neural route. For example, your herpes simplex virus 1, they already stay in the ganglia, so for them just a matter of trouble the other way, ascending into the central nervous system. So viruses to the neural route, bacteria to the blood route. So the ability for these bacteria to cause meningitis mostly depend on the ability to produce capsule. So the capsule have the ability to prevent phagocytosis, which is the uptake of bacteria by white blood cells. So this is an important factor for these Neisseria, Haemophilus, and Streptococcus pneumonia. Listeria is interesting because they have a special protein they produce called internalin, which attached to another protein called cadherin. Cadherin is a protein found on the intestinal cell membrane. So our body intestine cell produce this cadherin that put on the membrane, and then Listeria produce a protein on the cell wall that called internalin. The two protein internalin and cadherin are key and lock, so they recognize each other and able to form a tight bonding. So they still use that as a way for them to bind to the intestinal membrane. Remember, Listeria come in to contaminate the food, right? So you can consume, and then they get into the intestine, and they use this to allow them to bind to the intestinal epithelium, and then they can penetrate that layer, go down to the gut, and causing food poisoning. Actually, Listeria it causes food poisoning called listeriosis. On the bottom there, right? It's basically you have diarrhea and all those symptoms of the food poisoning. So so one, they cause that they can chew the blood, as we said, and then they can circulate it and enter central nervous system. Now, cadherin not only found in the intestinal cell membrane, but also found in the blood-brain barrier. So the choroid plexus, the blood-brain membrane barrier, also produces cadherin. So when they're still able to get to the central nervous system, they can use that internalin for them to bind to that area and help them to get over to the central nervous system side. So not only found on the blood-brain barrier, but also found on the fetal placenta barrier. So allow us to get into the baby in the womb. So pregnant women we have to be careful with this Listeria because it can get inside and causing abortion. So that's the reason why they found Listeria in contaminated milk or other product. They do a recall. They don't want to get into this sort of situation where the pregnant woman will lose the baby. So typically, as I said, the Listeria cause listeriosis, primarily in the older adults, person with a weakened immune system, pregnant newborns. So the typically healthy individual, even we consume the contaminated food carrying Listeria, we generally won't come down with with listeriosis. But in those group of people, weakened immune system, pregnant women, older individual, they are more susceptible to diarrhea or food poisoning caused by listeria. So here's a few of this listing again about the diagnosis and treatment. Treatment of bacterial meningitis, the key underlying a prompt treatment, because this meningitis can kill within 2 or 3 days very quickly. So typically people who have the sudden onset of high fever, neck stiffness, and plus other symptoms like confusion, kind of thing, they check into the ER. The ER doctor will make the initial diagnosis, and then will right away, probably assuming that the initial diagnosis think that it's meningitis, they will put on antibiotic treatment. So they don't wait for the CSF test result and all those things, because there's no time to wait. So prevention, as I mentioned, you can use there are vaccine out there for Haemophilus, and also vaccine out there again pneumonia that we mentioned previously to prevent pneumococcal pneumonia. So that will prevent meningitis as well, caused by streptococcus pneumoniae. Meningitis, there is a very effective vaccine called MenC out there, but they are not widely used. They're only used when there's outbreaks. The school have a case, then the rest of the student in the school will be vaccinated. So, or there's a military base, they have an outbreak, they do that outbreak management, but not widespread vaccination. I guess the reason for that is that the way the cost of vaccinating everybody versus managing it in outbreaks cases, it seems to be more costly in the universal vaccination. So the mother have been tested to carry this organism. There will be the kid will be given the newborn will be given the antibiotic. So we just look at bacteria meningitis, but there are other organisms that are capable of causing meningitis. Just one more example. This is the fungus they call Cryptococcus neoformans. This Cryptococcus is sort of a yeast-like fungus. So it's unlike what you're familiar with. Funguses are forming long hyphae and mycelium, like those that you seen on your oranges have got moldy, or your bread have got moldy. Those are fungi that form mycelium. But Cryptococcus is like your yeast that you use to make bread and wine. So there's a round-shaped spherical single cell yeast. So the picture that on the right there, in the middle of the clearing, you can see the round-shaped structure cell. Those are your Cryptococcus. So the clearing surrounding those Cryptococcus cells are capsule. So this organism are capable of forming a thick capsule, which make a carbohydrate. So it play actually an important role in Cryptococcus' ability to cause disease, in this case meningitis. So we call it cryptococcal meningitis. So how do we come in contact with this organism? It basically through inhalation of the spore. They do produce spore, or there's dry cell that have the yeast cell have been dried up, and so Where do you find the cryptococcus? Mostly in vegetation, plants, on the leaves, on the plants. So they got sort of like blown into the air by wind, or some other means disturbing the vegetation. So people walk by, breathe it in, they get into the lung, so they can. Then from the lung, they get into the bloodstream and cause go on to the central nervous system. So this organism is fairly prevalent in vegetation. Luckily, it's not that virulent. So for healthy individual, typically we don't have any problem with that. But for the immune compromised person or people with underlying condition that weaken their immune system, they are the one that are susceptible to cryptococcal infections. So you can see the symptom there tell you a little bit about where start the infection in the lung. So you have prolonged cough, chest pain. So these are all symptoms of the lung got infected, and later on this organism enter the central nervous system. So there are antifungal drugs that are effective against this cryptococcus. So the gold standard one is amphotericin B. You can also use 5-fluorocytosine. This can be given to patients or people who come in infected by it. So because it's so prevalent in the vegetation and nature, so it is almost impossible to avoid coming in contact with it. So the good news is that it's not very virulent to healthy individuals. So we're going to move on to encephalitis. This is, just to recap, this is a disease referred to the infection of the brain parenchyma. So viruses is the cause of encephalitis. Bacteria are not known to cause encephalitis. So there are two groups of viruses that are most common cause of encephalitis. That is herpes simplex 1. So this is the same herpes virus that causing herpes or cold sore in the oral cavity. So this virus is probably present in about 30% of the population. So people who have cold sore, you're never able to get rid of it. So you have recurrent case of cold sore. The reason for that is that the herpes simplex virus sort of remain dormant in the ganglia of the trigeminal olfactory nerve. So when they receive some signal like stress, it's one of the common one. Sometimes even UV light can activate this herpes simplex virus from the ganglia, and then they will travel down to the trigeminal nerve or olfactory nerve ending and landed in the epithelium and start to cause a lesion. And then 7 to 10 days later, the lesion sort of gone down. This virus sort of retreat back into the ganglia. So they didn't go away, but rather go up and down like this. So if they travel down the nerve ending, that's give you the cold sore. If they travel up the nerve, then they can gain access to the central nervous system and cause encephalitis. So they still do not know what causing this herpes simplex virus 1 to travel up the nerve to cause encephalitis. There must be some signal or some condition that promoting it to do that way rather than coming down the nerve ending to cause cold sore. But nevertheless, this is one of the most common viruses that cause encephalitis. So the other group of viruses that commonly causing encephalitis is called arthropod-borne virus or arbovirus. So there are 6 of them. Many in the Americas, so that is North America and South America, and they're named after where they discover the geographical region. You'll see the name in a minute. So the symptom is very similar to meningitis, high fever, and that sort of thing. You don't need to worry about much about that. Some patients report body ache and develop skin rash. If not treated properly or cured from it, a person can suffer from permanent neurological damage. So this a few examples of the arbovirus. So mosquito is the main insect that transmit this virus from animal to human. So the diagram on the left shows that you have the human on top and then the mosquito in the middle. Then you have rodent, horses, fowl, whether you have birds and chicken. So those are the source of the virus. So the virus can live in these animals, and then when the mosquito will transmit them to human. So the diagram, you can see there's two type of arrows. One is one arrow, the other one two arrows, back and forth. So what that means is that the direction of transmission. So the mosquito can transmit the virus to human. So that's actually a one-way arrow. So in other words, if a person suffers from encephalitis, it cannot be transmitted by mosquito. So you have a patient on one bed who have encephalitis, mosquito come and bite the patient and will not carry this virus to the patient next door. So it's a one-way street for transmission from mosquito to human. But that's not the case with rodent. Those or the fowls, the birds and chicken. You can see the two-way arrow means that the mosquito carry the virus can transmit to those animals. Horses, same thing, one-way arrow. And then in the winter months, this virus actually got associated or found in the mosquito eggs. So that's how the virus survived through the winter. As you know, mosquitoes a summer month thing. So in the winter, they lay eggs before the winter. The eggs will survive throughout the winter. When the egg hatch in the spring or summer, then they become alive again, and then will be carried by the mosquito. So you can see that the viruses are given this EEE, WEE, and so on. So they'll refer to, on the bottom you have EE stand for Eastern Equine. So those are the horse on the Eastern America. So the number of them based on where you find them. And so even one you have Venezuelan, that's a South America country. So these are the viruses. So we're gonna say a few words about one of them. That is a West Nile encephalitis. This is one of the one listed in the previous slide, and this is an RNA virus, single-stranded, and it enters the body to insect bite. So you have mosquito, the carrier, come and bite a person, will transmit, infect the person. So the whole variety of symptoms here, I think you don't have to memorize all this. It's basically very similar to other CNS infection. You have convulsion, all kinds of things, fever and so on. You do have that neck stiffness, but it's not a main symptom. So you do have some report of minor neck stiffness and that sort of thing. So one of the things that worth mentioning of the symptom is a paralysis. So it is the last one, or second last one listed there, because this one of the side effect or the outcome of West Nile encephalitis and lead to paralysis. And that's, a number of cases are reported, even in Nova Scotia. A number of years ago, there was a lady who got infected by West Nile and ended up paralyzed. He was suing the province for that condition. Now, where do you find this West Nile virus? This virus live in a bird called, you probably know what it is, in the morning, make lots of noise picking your garbage. That's a crow. Crow is well known to harbor this West Nile virus. I think blue jays also can carry this virus, but the West Nile virus, when they infect the crow, can lead to the death of the crow. The crow can suffer and can die from it. And then, I remember one year there was in Nova Scotia there was outbreak of this, and then the provincial government were telling people to report any dead crow on the sidewalk or in the wood or park whenever you encounter. So they will send out people to collect the dead crow and then send back to the lab to analyze whether the dead crow was died of West Nile infection. So typically there's no treatment, there's no drugs that is effective against this virus. Basically, it's a supportive therapy, make the person comfortable and that sort of thing. So elderly and weakened immune system are the kind of people who are more susceptible to this infection. How do you protect yourself? Prevention, basically prevent contact with mosquito. So you can use your wear long sleeve shirt and long pant, use insect repellent to keep the mosquito away, that sort of thing. So you are outdoor lover that like to go camping. So those are the kind of the protection, prevention measure that you want to do to protect yourself. So brain abscess, these are caused by a bacteria, fungi, and other agent. I think one of the ones that stand out that relevant to dentistry are the group of organisms called Streptococcus aeruginosus. Aeruginosus group of streptococci, there are 2 or 3 species in there. These are organisms present as part of the dental plaque organism. So a dental plaque will compose of some of these aeruginosus organisms. So beside Streptococcus mutans that you're familiar with, or Goldoni and Oryris, this is also part of the dental plaque organism. So they can get into the bloodstream, obviously through some means of gaining access to the blood, and then get into to the brain and causing abscess. So the Candida species that is a fungi is also a cause of brain abscess. Candida, this is the same one that found in oral cavity, the one that caused candidiasis. So the organism found in the oral cavity are part of this agent that causing brain abscess. So obviously, as I already mentioned, these organisms in the oral cavity, they need to find a way to get in to the central nervous system. So they could be from mastocytitis, which is infection of the bone, sinusitis or dental sepsis, trauma. Trauma could be from a broken tooth, or can be from even, you can say, dental surgery may be a trauma. That sort of way for the organism get in the bloodstream. So most patients with a brain bacterial brain abscess require surgical drainage. That's not fun, right? You have to open your skull and get the drain off the liquid and abscess, and that's a major surgical event, and then obviously that drainage will help to as a treatment combination with antimicrobial treatment. So, what are the features that we talk about that's important for dentists or dental hygienists? So, these are four main points here. So, organism causing central nervous system infection are common residents of the normal microbiota. What is said about the brain abscess in the previous slide. And then many of them can colonize the nasal pharynx, for example, your Neisseria or Haemophilus, Streptococcus pneumoniae. Those are the common organisms that colonize the nasal pharynx. So, and then you obviously, then the second point is that you have this secretion of this infectious agent into saliva and respiratory secretion, particularly herpes. It can be found in the saliva, a person who have cold sore, so that become a means of transmission to another person. So bacterial infection of the facial area may spread to contiguously to central nervous system. So you have dental sepsis, mastocytitis, all those create that opening of opportunity for the organism from the oral cavity into the central nervous system. Then the infection itself can cause central nervous system, and so infection itself can cause nerve damage, particularly the cranial nerve damage. So there are conditions called cranial nerve palsy in tuberculous meningitis. That means that people have Mycobacterium tuberculosis leading to meningitis, the chronic meningitis, and the cranial nerve can be damaged, causing this cranial nerve palsy. And then people with herpes, here called herpes zoster infection, caused by herpes simplex 1. Then can have a condition called Ramsay-Hunt syndrome. These are facial palsy. So this is the consequences of the herpes infection. So the next slide I have more on these two conditions. So on the left is your paralysis of oculomotor nerve in tuberculous meningitis. You note that the eye, the left eye, is sort of like have a part different from the right eye, and this is due to that cranial nerve have been damaged. So obviously the muscles, the lateral muscle will be not working very well. The person may have problem opening the mouth properly or eating, chewing, and that sort of thing. The same thing with Ramsay-Hunt syndrome. You can see this is caused by herpes. You can have even have lesion on the ear, so vestibular rash on external ear, and then lower motor neuron paralysis of the facial nerve. Then loss of taste sensation over 2/3 of the tongue, and then you can also see how the facial different between the left and the right face, and then the mouth will not be able to close properly, leading to constant drooling. So saliva will keep coming out, and obviously this sort of patient will have a hard time moving their mouth properly. So that poses a little challenge for dental treatment and dental care as well. So these are the side effects of central nervous system infection. So here's the chapters that you want to read on more in the textbook list in the Whitehead source.